The state of Medicare has once again taken centre stage in Australian politics, with Nationals leader David Littleproud slamming the Albanese government over the rapid decline in bulk billing rates. While Labor has pledged a hefty $8.5 billion investment in Medicare, promising that 9 out of 10 Australians will have their GP visits fully covered, the coalition has not only matched that commitment but has gone a step further, promising an additional $500 million in funding. Speaking with Sky News Australia, Mr. Littleproud didn't hold back, arguing that the numbers paint a grim picture under Labor's leadership. When we were in government, the bulk billing rate was at 88%. When Peter Dutton was health minister, he had it at 84%, he said. Now, under Mark Butler and Anthony Albanese, it's plummeted to 77%, and it's only heading south. Meanwhile, 2 new polls released today suggest that the coalition has widened its lead over Labor as the federal election looms. Mr. Littleproud was asked about the latest figures and whether they were enough to secure a majority government for the coalition. "Oh, look, I wouldn't read too much into the polls," he said. "The significant variance in these numbers shows it's not an exact science. There's a mountain to climb if we are going to secure majority government, which is what this country needs." He went on to suggest that Australians are beginning to seriously question whether they feel safer and financially better off after 3 years under Albanese's leadership. "I think that question will only become louder as we get closer to the election," he said. "But we can't get ahead of ourselves. The focus needs to remain on the Australian people and delivering real solutions, not just reacting to polls." When pressed on what work still needed to be done, Mr. Littleproud said the coalition must continue to present a clear plan to address the cost of living crisis, which is hitting everyday Aussies hard. Right now, people are feeling the pinch. They are struggling to keep up with rising costs, and the simple fact is, we need to drill our way out of it, he said. The fastest way to bring down power bills in the short term is gas and more gas. Long term, nuclear is the way to go, but right now, we need to flood the grid with gas to drive energy prices down. That'll help with food prices, too, because when food processors are paying through the nose for power, the cost of groceries goes up. The Nationals leader also took aim at the government's housing policies, arguing they had failed to increase supply and only made it harder for Australians to buy a home. "We are seeing the madness of a 7-star construction code adding $60,000 to the cost of building a home. That's pushing homeownership further out of reach for young Aussies. We won't just pause it for 10 years, we'll go line by line and rip out the unnecessary bits," he said. "We need a housing policy that actually gets homes built, not just empty promises." Littleproud also suggested the government's migration settings were making things worse, bringing in workers who aren't helping where they are most needed. "We need to be prioritizing tradies to build these homes, not dog groomers and martial arts instructors," he said. As election season heats up, healthcare is shaping up to be a key battleground. The Labor government recently unveiled a massive investment in Medicare, but Health Minister Mark Butler has claimed that the issues with bulk billing stem from decisions made when Peter Dutton was health minister. Littleproud wasn't having any of it. "Just look at the numbers," he said. "When we were in government, bulk billing sat at 88%. Even when Peter Dutton was health minister, it was 84%. Now, under Labor, it's at 77% and falling. They've completely ignored general practice, and now we are paying the price." He argued that while the coalition supports the funding increase, the key issue is making sure the money goes into quality care, not just quick fixes. Doctor groups need to be listened to. This can't just be about political optics, it has to actually work for Australians. And while they are throwing money at Medicare now, they've completely forgotten about mental health, he said. According to Littleproud, mental health services have been neglected in Labor's health plan, despite the growing demand in communities across the country. This government's so focused on fixing the political problem they created, they've overlooked one of the biggest issues Aussies are facing: mental health. That's why we are putting $500 million into 20 additional mental health sessions, making sure people get the support they need, he said. Today, Mr. Littleproud is on the ground in the Queensland electorate of Hinkler, where the LNP has put forward a new candidate, David Batt, following the retirement of Keith Pitt. When asked about the importance of healthcare in regional areas, Littleproud pointed to new research showing mental health was one of the most pressing concerns for locals. A Salvation Army report just out today confirms what we already knew: mental health is one of the biggest issues in Hinkler. And yet, the government hasn't put an extra cent into it, he said. He argued that regional Australians were being left behind and needed more access to telehealth and face-to-face mental health services. "We need more boots on the ground, plain and simple," he said. As for the coalition's candidate for Hinkler, Littleproud backed David Batt as the right person for the job, highlighting his experience as a local councillor, policeman, and state MP. "David's a local through and through, he understands what's happening in the community, and he's got a plan," he said. From infrastructure projects like Paradise Dam and the Bruce Highway to mental health services, these are the real concerns for people here in Bundy and Hervey Bay. With the election looming, both major parties are sharpening their focus on healthcare, cost of living relief, and housing affordability. The coalition is pushing for more gas, a migration overhaul, and a hard reset on housing policies, while Labor is banking on its Medicare investment to win back public support. Whether Australians buy into Labor's pitch or back the coalition's promises remains to be seen, but one thing's certain: it's going to be a fight to the finish. Let us know your thoughts in the comments below. Make sure to like, subscribe, and hit that notification bell so you don't miss our next update. Cheers for tuning in, and I'll catch you in the next one.